If you're pregnant and dealing with SIBO symptoms, you're probably stuck between two fears: doing nothing or doing the wrong thing. You've been told to restrict more foods. You've been warned about treating too aggressively. And somehow you're supposed to protect your baby while your digestion feels completely out of control. Well, here's the truth. Pregnancy changes your gut on purpose. And if you don't adjust your strategy to match your physiology, you're going to stay frustrated and exhausted. So let's talk about what actually makes sense during pregnancy and what needs to stop. It's no surprise that the way the body functions for a female during pregnancy shifts. And pregnancy also causes dramatic shifts in the way your gut functions as well. Hormones are shifting, your motility is changing, your microbiome is adapting and shifting as well, and your immune system is going through an entire recalibration process. So if your approach to SIBO during pregnancy is the same as it is outside of pregnancy, well, frankly, you're already off course. The goal right now should not be eradication. Actually, that's never the goal. But more importantly, the focus should be on stability, nourishment, and safety for you and for the baby. And that requires a different mindset. Why do SIBO symptoms change during pregnancy, and what's actually happening? No surprise, progesterone levels are going to increase during pregnancy. That's simply to maintain the pregnancy, progestation. However, progesterone is also going to have additional effects. One of those is that it's going to slow down the motility of the gut. It does that by relaxing the smooth muscles in and around the gut. And in addition to that, it's also going to lessen the intensity of the nerve responses that are stimulating those smooth muscles as well. So those natural waves of clearing that continue to move bacteria from the small intestine to the large intestine, well, those natural cleansing waves, they're not as strong and as robust as they can be otherwise or as they are outside of pregnancy. This is protective for pregnancy. This is important for pregnancy, but it can also be a challenge when it comes to SIBO. Because remember, the slower that motility is, the more of an increased overgrowth risk that you have. You add to that the microbiome is going to shift as well. The microbiome naturally shifts during pregnancy, and it's doing it for the purpose of increasing the extraction of calories from food and increasing the energy demand that is placed on the female body by the fetus. There's also an observation that the diversity of the microbiota declined during this time as well, which means that you have overall a bit of a less resilient gut ecosystem, if you will. And that might unintentionally aggravate some symptoms in some individuals. And maybe the last piece that I'll layer into this is that the immune system tolerance is also shifting as well. And that's because of the developing fetus. This is by design. You don't want the immune system being overly reactive to the developing fetus. If you put these things together, you look at the progesterone plus this microbiome shift, that overall is going to promote slower clearance. So when you're looking at these SIBO symptoms during pregnancy, you don't want to look at this and think that your symptoms are suggesting that there's failure or that you're failing in your attempt. That's not what that's telling you. They're actually meant to tell you that the pregnancy physiology is interacting with an already sensitive gut, and it's doing what it's supposed to, but the gut is not in a stable state to be able to optimize through this phase of life. Whether pregnant or not, restriction is often a part of the SIBO strategy. But let's talk about why that strategy is the wrong strategy and what needs to stop. If you think about long-term application of a low FODMAPs diet, that is more of a fear-based avoidance where you're starving the bacteria mentality, if you will. You're not giving them what they need, so they're just going to go away. I hate to break it to you, that's not how that works. But the point is that this is a physical and a mental stressor, neither of which of those are things that are desired during pregnancy. We want the mother to have an optimal environment for that fetus to develop in. Because when you start restricting, here's what starts to happen. Number one is that you're increasing your stress hormones, especially if you're not consuming adequate carbohydrates, which is one of the things that tends to decline with a FODMAP's dietary protocol. In addition, you're reducing your microbial resilience. You're not giving those microbiota what they need to function optimally. And as the diet narrows down, that also tends to worsen or exacerbate nutrient deficiencies. Pregnancy is not a time to be dealing with nutrient deficiencies because those are going to be limitations in the developmental process for that fetus. And Mom, you've got your own things going on during this time that you're trying to manage. There's so many things that you're trying to juggle. So there's no need to try to add to the mental strain that comes along with this restrictive mindset by approaching it with a FODMAP's diet. We want to reduce that mental strain. So the bottom line here is that first of all, you just can't restrict your way to health, period. But that is even more of the case when we're talking about pregnancy. That brings us up to what I would consider to be the pivot point. And most women managing SIBO are stuck in one question: how do I kill this? And that mindset is going to always create fear, restriction, and you're going to be in this pattern of second guessing yourself. And during pregnancy, that's actively working against you. This is not the mindset and strategy you want to be facing or approaching SIBO with. So the better question is, how do I support stability? How do I do it safely? And how do I get it done right now as opposed to having to wait until after pregnancy and lactation? And this single shift is going to change everything for you, because during pregnancy, your goal should not be eradication. And just as a side note there, remember I said that's not ever the goal here. The goal is you're looking to optimize microbial balance and physiological balance. You want the systems of the gut to be working together. Your goal is creating a stable environment for both you and for your baby. That mental shift alone can reduce the symptoms for many women. If this already feels different than what you've been told and it's reframing the way that you approach SIBO, well, go ahead and hit that like and subscribe button. And if we haven't met, I'm Dr. Arland Hill. I'm a clinician and a rancher, and that allows me to see both sides, the physiology and the food. I work with gut dysfunction every day, but I also raise nutrient-dense food. And that perspective matters, especially during pregnancy, because physiology and food, they can't be separated. Let's talk about what's reasonable to support during pregnancy. And as I go through this information with you, understand that what I'm sharing is only conceptual. I'm not giving you protocols. You need to follow up with this specifically with your practitioner. But one of the things that you can do is have some gentle digestive support. Let's go through what options you have before you. Number one is we can make efforts to replace the stomach acid. Betaine HCl is the way to accomplish this. You can also use and make sure that you have adequate nutrients, zinc, B1, chloride. These are important in this process as well, but if you need to get it done directly, betaine HCl or betaine hydrochloride is the way to accomplish that. And this can be lower during pregnancy. There's an association with progesterone here. The reason that it's important to have betaine hydrochloride is because this is one of your first line defenses. Stomach acid is a first line defense when it comes to offsetting SIBO and these organisms building up and manifesting. In addition, it's also going to optimize your access to nutrients, and protein digestion is going to be more efficient, both of which are obviously essential when it comes to pregnancy. Now, right in line with that, as far as digestive support, we can look at our pancreatic enzymes. This is going to complete the digestive process, and most likely if you don't have adequate hydrochloric acid, you're not going to have adequate enzyme production either, because the acid is the trigger to optimize the release of the pancreatic enzymes. And the third one here is going to be bile. This is really going to round out the trilogy of your primary digestive secretions, the acid, the enzymes, and the bile. As it relates to bile specifically, your gallbladder contraction can be slower during pregnancy. Again, a byproduct of progesterone here. And when it comes to pregnancy, there is a risk of what's called bile stasis. So just simply meaning that the bile in the gallbladder is not flowing as smoothly and efficiently as it should. Long term, this can, or during pregnancy, let me say it that way, this can impair fat digestion and can affect fat soluble nutrients and can affect the access to important fatty acids that are essential for neurological development in the fetus. You also need nutrients like vitamin A and vitamin D. Those are very important during this time frame just because of the rapid rate of cell division that needs to be supported and nurtured also. But digestive support is not the only option that you have here. You can also look at using select probiotics. I'll give you two categories to think about. Number one are going to be some of your lactobacillus species. Remember I said earlier on that during pregnancy there's a microbial shift. These lactobacillus organisms fall under that category or under that context. But the one that I would point you to mostly here is going to be Saccharomyces boulardii. The reason I'm pointing you in this direction is because this is a non-colonizing organism. After you discontinue taking this, within 3 to 5 days, it's left the body. It's very well studied. It's well tolerated across the board, and it's going to support rebuilding the gut barrier and optimizing immune balance at the same time that it's inhibiting and optimizing that environment of the microbes in the small intestine. Now, let's talk about one layer deeper here, if you will, because remember I said I've pointed to progesterone so many times through this conversation already. And progesterone, because it's increasing, it can negatively affect motility. So what can you do to optimize motility, but without forcing it? We're not trying to have a purging effect. That's not the goal here. Well, some of the things that you can look at, number one is that you can optimize your bile. So we talked about bile as it can be used for digestive support, but bile also enhances motility. Right along with that, make sure that your food choices during this time are clean so that you can get the nourishing effect to the microbiota so that they can serve their role in supporting motility as well. It's the last thing that I'll say along with the food choices there, somewhat when I say clean food choices, that's more of the what you're eating, but it's also just as important, if not more important, in regards to how you eat, not necessarily just what you eat. And the how you eat comes down to food timing. So instead of taking a approach of grazing continuously throughout the day, your caloric intake is increasing during pregnancy, but those are modest increases that we're talking about. Those are modest increased demands that are being placed on the female body. There's not massive amount of caloric intake that needs to be increased here. So you can still generally get that increased caloric demand through your 3 major meals. And if you need to throw a snack in there, that's fine. But generally trying to optimize the food intake around those 3 major meals is going to be best because that's also going to optimize the motility and the clearance as well. Now, you may want to think about this also. If you've got SIBO, you've got to think about, well, I've got some inflammation in the gut. How do I manage that? Well, let's go back to food for a moment and think about food not just as calories, but think about food as information. That information, that anti-inflammatory effect that we can generate through food, because many times anti-inflammatory is what we often term under the anti-inflammatory context, whether that's botanicals or some type of medication, if you will, pharmaceutical. Those are not things that are desirable during this time frame. And in that light, we would want to lean more towards food to try to generate that same response. This is also why we want to stay out of that restrictive mindset when it comes to food, because being too restrictive with food is also going to limit your access to those anti-inflammatory gut supporting nutrients. Now, many of you are going to say, well, what about the overgrowth? How do I reduce the overgrowth directly? Well, one, again, I have to press you on the fact that all you need to do is get the overgrowth under control. That's not the resolution for SIBO. Whether you're pregnant or not, that's not the resolution. But if you're looking for safe options here, the truth is that there aren't many to lean into. And from my research on this, I've only been able to find one that I think is a reasonably safe option, and that's going to be garlic. Now, again, I'm not recommending that you do this. This is the one that you need to, again, discuss with your practitioner. But keep in mind that when we look at botanicals or anything else, and as it relates to is it safe during pregnancy, we have to have direct safety data to be able to say that. Not just there's an absence of problematic data. We need to be able to definitively say that there is safety data. Unfortunately, that data just doesn't exist. The point here is that none of these approaches that I've given you here are aggressive. That's not what we want to do, but they are all protective and they're all supporting microbial balance, not trying to take this aggressive sterilization effect. With pregnancy and SIBO, one of the things that has to stay top of mind here is that nutrient deficiencies cannot be ignored. In fact, nutrient deficiencies are one of the characteristics of SIBO. Pregnancy is not the time to be dealing with nutrient deficiencies. Therefore, we need to look at what nutrient deficiencies are likely to occur with SIBO and could be problematic, especially during pregnancy. And so the ones that I would point you to here are going to be B12, iron, zinc, your fat-soluble vitamins, vitamin A, D, E, and K, and then also looking at optimizing for protein intake. There are certainly other nutrients that could be problematic here as well, but those deficiencies that I just listed off are also ones that are highly likely to occur during SIBO. So having a blood count, having some way to assess for these nutrient deficiencies is critical during this time. You want to make sure that you're optimizing the development of the fetal brain, that you're optimizing for energy production, and many of these deficiencies that I just listed off could be the precursors for an anemia. So we want to make sure that we're optimizing the intake of these, supplementing around these if we need to. If these are deficiencies that are present, put those nutrients in and correct these deficiencies, get past that anemia, and make sure that you're giving your body every chance to support energy production, that if there is some dysfunction in the GI tract, that you can optimize for gut healing and rebuilding. That's all a byproduct of these nutrients. Clean, nutrient-dense food always matters, but it especially matters during pregnancy because you need more nutrition during this time. You can't just settle for the status quo. You need above the status quo. You want to be able to maximize bioavailability and nutrient density. And this is why I care so much about how food is raised. When you're looking at clean, nutrient-dense animal foods like properly raised beef and poultry, they're reliable sources of B12 and iron and protein that can optimize the pregnancy. They're not restrictive. There's no fear based around them. This is just the nourishment that your physiology needs to be more balanced. Pregnancy is already increasing your sympathetic tone, which is your tendency to be in more of a fight or flight type of state. It's normal. It's what supports the increased demands that the female body is going through. However, when it comes to SIBO, it's also going to amplify the gut sensitivity. So when you're looking at how do I support this, here's some things to keep in mind. Be extremely protective of your sleep and optimizing your sleep habits. Make sure that you're doing activities that are calming to your nervous system. Keep yourself out of that fight or flight mode as much as you can, especially when it comes to being around food and eating. That's definitely not the time to do that. There's a reason that we call the opposite of fight or flight rest and digest. You want to implement exercise properly. Engaging in activities like meditation is a great way to be able to optimize in this more parasympathetic, non-fight or flight state, which is going to help keep your physiology more balanced and it's going to support more calm digestion. Let's talk about what this video is not about. And it's not about talking about antibiotics. Antibiotics are not ideal. They have a time and a place, but they're not ideal. Most during pregnancy are definitely not going to want to use these. We're not looking at kill protocols. That's not recommended right now. That is absolutely the wrong mindset. And introducing harsh antimicrobials, harsh botanicals, that's not even an option during this time frame. We want supplemental doses that are individualized and that keep pregnancy in context, remembering that there may be a necessity for higher or lower doses during this time. And we're not trying to force symptom suppression. That's not ideal either. Over the long term, that actually makes things worse, and it's not ideal for nutrient requirements. We need to fix that underlying function in the gut. These are decisions that need to be individualized, and they also need to be handled very carefully. So this video is more about how to think and not a prescription for you, which is why I didn't put dosages in this video content. You really need to look at how do I use this information for me personally, and how do I restructure the way that I think about SIBO, especially during pregnancy. The practical takeaway here is that if you're pregnant with SIBO, you don't need to be afraid. You're not failing, and you can still be proactive. But you're playing the long game, and that's exactly what your baby needs. If this video helped you breathe a little easier, go ahead and share it with another mom who's struggling silently. And if you want to understand how food quality supports maternal and fetal health, I've linked the next video here for you.